it took him a little while to find it, I think, but he found it. He says, I can see it. He says, unfortunately, there's nothing I can do for you.
So let's get to your floaters. First of all, give me an idea of the timeline of onset. Subjectively, how you had experienced it, how it interfered with your quality of vision, your quality of life. These are the things I think people find relatable.
Yeah. So going all the way back, I think I'm 58 years old now. When I was in my 40s is probably when I first experienced floaters, right? But they were generally pretty benign and they didn't bother me. I heard a lot of people had them. I used to be a glasses and contact lens wearer before I had LASIK and PRK, my opticians would just tell me, yeah, that's a normal thing, for your age. But I guess it's about 7 months ago, I was on a work trip, and all of a sudden I just noticed this big floater just appeared in my left eye, and it was right in the center of my field of view, and it came on very suddenly, and it was big, and it wouldn't go away. I couldn't like dart my eyes and make it go, off to some other place that it didn't bother me. So I went to I was on a business trip at the time, so I real quick looked on the internet, tried to find a person that I could talk to, so I talked to a doctor, and she saw me that day, and she looked in my eye, dilated it, and she said, I can see the floater. Yeah, but fortunately there's no damage to your retina. This will probably just go away soon. Nothing to worry about. So,
and I'll interrupt you for a moment. Like, that is kind of the standard of care, and that's how I was trained, and that's how most people are trained, and that's how most people experience this. Sudden onset, something moving and floating by your vision. The first and most appropriate thing, if that's happening, if this just happened to you, is you get it checked out locally, and preferably a dilated examination. Sometimes, especially the optometrist will not do a dilated examination. They have a camera that can do a good wide angle photograph, but it's not quite the same thing, at least the way I was trained for doing a dilated examination. And the purpose is not to find and map out and describe the floaters. The purpose is to rule out a retinal problem. Make sure that person doesn't have a retinal hole, tear, detachment. And what Edward experienced, at his age, at sudden onset, is usually attributable to a posterior vitreous detachment, and I just did a video describing that. So the doctor did the right thing, ruled out retinal problem, gave you a big dose of reassurance, and said, well, the good news is this is not a progressive blinding disorder. What next?
Yeah. So then, so I came back home from my business trip, and it wasn't going away, and I had difficulty reading. I spent a lot of time looking at computer screens, and when it's right there in the middle of where you're trying to read, basically meant that I could only read with my right eye. Also driving, it's blocking me from being able to read signs properly, from seeing traffic properly and things like that. So I think it went about 6 weeks or so, and it hadn't gone away. So I made an appointment with my local person that handles my glasses and stuff like that. And I see her for like a regular routine checkup every year. I went in, she did the same thing, dilated my eye, used that special camera that you look in, and took a picture and looked in, and she basically had the same conclusion. She says, yep, I can see it, it's there, and there's really nothing you can do about it. I was like, really? Nothing? There's nothing I can do, right? And she just said, no, just hopefully it will go away. So I was really unhappy with that answer, and I found a doctor, made an appointment with him, and he was someone who advertised that among the other things that he did, he was an ophthalmologist, he does this YAG laser vitreolysis. So I went in, made an appointment. I think in about probably 10-15 minutes, he looked all inside my eye. It took him a little while to find it, I think, but he found it. He says, I can see it. He says, unfortunately, there's nothing I can do for you. And I was like, oh, come on. So I explained, he explained to me that he felt that it was too close to the posterior capsule of my eye. Right.
Too close to the lens.
Yeah, too close to the lens.
And somebody who hasn't had cataract surgery.
Right. And he explained to me that, he didn't feel comfortable hitting it with the laser because he was afraid that he might nick that back capsule of the eye, which would cause an immediate cataract,
Right.
and then I would have to have cataract surgery probably very quickly. So he basically, as a professional, right? He said, "I'm not going to do it for you. I don't feel comfortable." And I was like, "Okay, well, what are my options?" And he basically says, "You pretty much just have to wait till you're about 80 years old, when the vitreous humor will lose its viscosity. It'll get very clear and watery, and the thing will probably just fall on its own." And that was a very unsatisfying answer to me.
So 20 plus years.
22 years.
For something that might or might not happen. Basically saying nothing can be done, where the floaters are is not safe to treat with the laser, and Edward says, I wonder if there's something else out there. Right?
So by this time I've been told by 2 optometrists and 1 ophthalmologist who says he's an expert in this area that nothing can be done. So I was not very happy with that, sort of depressed about the whole situation, thinking, I got to live with this thing in my eye, all this time. But I didn't give up, right? So I get on the internet again, and I go to Google AI, right, Gemini, and I just typed in the situation, right? And I was like, what options do I have? And Google AI actually said, hey, there is an expert in Texas, Dr. Johnson, and they say he is known as one of the couple of guys in the world that can do these surgeries when other doctors have said that they can't do it.
So let's get to the nitty-gritty, where the rubber meets the road. Is we did a first treatment, we got you dilated. I took a look and I said, I see stuff I think I can treat. Like, it's in a pretty good location. I went through my 4-question checklist. Can I see something? Does it correlate? Does it track? Does it make sense? Are the optics good? Is it safely away from the retina and lens? And I felt so. I said, well, how about we do a treatment? So we did. It took me a lot longer to do the consultation than the actual treatment. Actual treatment was 10 or 15 minutes, if that. What about the level of pain and discomfort?
No pain at all, no discomfort at all.
I didn't see it.
I mean,
it's painless.
The worst part was just, there was a bright light in my eye, right? So I'm just trying to keep my eyes open.
And you did pretty well. You were a little sensitive, but you did pretty well. So the thing is, your pupils are fully dilated. I finish a treatment, and I have a feeling and kind of gestalt, like, here's what I think I've done, but it doesn't matter what I think, it matters what the patient thinks. And as I walk them out the room, he thinks he's seen some improvement, and he did. And so my usual statement to them is like, it's too early, your pupils are dilated, you can't rely on anything, but when you come back tomorrow, which is right now, I can just say, well, what did we accomplish? And you would say?
Yeah, I told you immediately, I would call it 90% improvement. The big floater is gone. It's out of my field of view. There are little pieces left over out on the periphery of my vision that don't bother me at all. If it never got any better than this, I would be 100% satisfied with what I've got.
I'm so glad to hear that. And of course, everybody's different. Everybody who walks through the door has a different set of circumstances. 100% perfectly clear vitreous is not the outcome that I can deliver. Vitrectomy, maybe, but we're trying to avoid the vitrectomy as an option. I think we've succeeded in that. So after this, I may not see Edward again until his right eye does the same thing, and then he'll probably be back. But at least he'll know the experience and what that kind of experience is like. Anything else you want to add?
No, I think that's it. It's been a great experience. I really like the fact that you, in the consultation, you sat down with this big picture of an eyeball and you went through the mechanics of how all this works, as well as sort of the idea of this step treatment program. You can do nothing, or you can do this as a first step, and all the way up to the extreme, kind of surgeries, and show me where in that realm of treatment we're talking. And you talked about all the risks. You talked about what the expected outcomes are going to be. So I was really happy.
Thank you so much for taking the time to do this. I greatly appreciate that. And let's get in there and let's knock out some more. Okay.